I'm very grateful that we have Dr. Day with us today to talk about this. For those of you not familiar with Lorraine, I can mention that she is a physician and an acclaimed orthopedic trauma surgeon that in 1992 developed breast cancer, biopsy proven, that became so severe that it eventually was diagnosed as terminal. But she refused chemotherapy, radiation, and mutilating surgery because of their dangerous side effects, and chose instead to get well by a totally natural 10-step health plan. I can also mention that her website is drday.com, and that's DR for doctor, so it's drday.com. And she has a lot of material on her website, and there you also can get her DVDs, her videos, and CDs on all kinds of health-related issues and much more. And we'll talk a little bit more about those later on too. And today, as I said, I've invited Dr. Day to mainly talk about food and health, and what kind of food is good food, and what is bad for us. And if we choose a vegan diet like I have, is there something special that we should take into consideration? And is there something more to good health than just right food and exercise? So there's very much to talk about. So welcome to the program, Dr. Day, and thank you for spending some time with us today.
Well, thank you very much for having me. It's a pleasure.
It's a pleasure. It's great to have you here. And as I mentioned there, you have quite an amazing, background story, so to speak, on how you became well and so forth, and in regards to your plan that you have developed. And I just wanted to ask you right from the top here, so to speak, when did you first start looking at a vegan diet as the best way to get well? Or maybe I should ask you first, you are a vegan, that's correct?
Yes, I am, and I was not always a vegan. And in fact, in the late first of all, as you said, I'm an Orthodox doctor. I was in the heart of Orthodox medicine as an orthopedic trauma surgeon. Not only was I vice chairman of the Department of Orthopedic Surgery at the University of California, San Francisco Medical School, training hundreds of doctors myself, but I was also chief of orthopedic surgery at San Francisco General Hospital. So I was in the heart of academic medicine. I was never on the fringes of medicine. I was on national committees. I testified to the government on certain issues. I was again, a prominent person in Orthodox medicine.
Yeah.
I believed everything that they had taught us, and I was teaching my medical students and interns and residents the same thing. In the late 80s, actually in the early 80s, AIDS just absolutely mushroomed in San Francisco, where I lived. And I operated on more AIDS patients than any surgeon in the country because I was at San Francisco General Hospital.
Yeah.
And all the time, my government, the United States, was telling us that this was not dangerous for surgeons. Now, that seems ludicrous now, but for years they were telling us that. And then they admitted that AIDS could be transmitted by needle sticks, but only for drug addicts. It couldn't be transmitted to healthcare workers. And I realized that, they'd lost their minds or something. So anyway, I was contesting with them all the time for more protection for us. And then on October 2, 1988, I think it was, the government finally admitted that a healthcare worker had gotten AIDS from a single needle stick, which they had denied could even happen, which was, of course, stupid for them to say it couldn't happen.
Yeah.
But at that point, I started, I got on the warpath, and I was invited to be on a number of television shows in America and Australia and England and various other places, countries around the world, because I had so much experience with operating on AIDS patients and all the risks that we were taking. Well, it was during that time that good folks out there in radio land started writing to me, and I realized there was a big cover up in the AIDS epidemic, which there still is, by the way. And so I started exposing this, and they wrote to me and they said, you think there's a big cover-up in AIDS, and there is, but you should see the big cover-up in cancer cures. Well, I was stunned because I thought, thought, oh, this can't be. Here I am high up in medicine, and how could anybody know this if I don't know this, you see?
Yeah.
But I decided that I would look into it because I had been so shocked with the huge government cover-up in AIDS and organized medicine cover-up in AIDS, too. So I started looking into it. Now, I didn't know at that time that I had cancer, but I found out indeed that there's a huge cover-up in cancer. And so I started going around the country investigating people who had gotten well from cancer, who had biopsies by legitimate surgeons in legitimate hospitals, and so the diagnosis was secure. I'm talking about pancreatic cancer and liver cancer that are virtually 100% fatal with orthodox techniques. And here these people were alive 12 and 14 years later and healthy, and they'd never had chemo or radiation, and I was really shocked. And I started a radio program called Truth Serum where I was interviewing a number of alternative doctors. It was during this time that I found out that I had cancer. And so one thing I found out common in all the people who had gotten well is they all went on a vegan diet. All right?
Yeah. Excellent.
So I knew that this was an extremely important thing to do. And I can tell you, I didn't learn this from medicine. I learned this from good people out there who are just plain folks.
Yeah, exactly.
They know more than doctors, I tell you. And so I went on a vegan diet, and a vegan diet was the right kind of diet. But it's not enough by itself to cure you of cancer or other serious diseases. But that's all I knew how to do. But I did that, and I refused chemotherapy and radiation. But in about 9 months, my tumor returned in the same spot. All right?
So, yeah, sure. So what
I thought, I don't know what else to do. I don't know what else. That's all I know how to do, and here it's obviously not enough. But I didn't change from the vegan diet. I kept on that. But then I started trying one alternative after another. And I talk about this on my videos and DVDs. I tried over 40 different types of alternative therapies. In fact, I have a DVD called Sorting Through the Maze of Alternative Medicine, What Works, What Doesn't, and Why, where I discuss over 60 different types of alternative therapies, over 40 of which I tried myself. But my tumor kept growing. And in fact, it grew from the size of a marble to the size of a large grapefruit in less than 3 weeks. And anybody wants to see how bad I got, you can look at my website at www.drday.com, and you can see the pictures of me there. And I was getting sicker and sicker and sicker, not knowing what to do. None of these alternatives worked. All right? So I was sick for 2 years, getting worse all the time. For 6 months I was bedridden, and at one point I was not expected to live through the night. I still refused chemo radiation. I still refused to go to the hospital, even though my husband at the time recognized that I was dying that particular night and said, you've got to go to the hospital. I said, I'm not going. Because I knew they would give me drugs, and I knew I had so little life left in me that I would die. And besides that, I knew that drugs do not make you well. Drugs never cure disease. Drugs all have side effects, and they cover up the symptoms. But frequently, the reason I refused chemotherapy and radiation is that as an Orthodox doctor, I had sent many people referred them for chemotherapy and radiation. And I have to admit that publicly now and say how sorry I am. But I didn't know any better. And so I saw too many thousands of patients die from the treatment, not the disease, the treatment that we gave them. You cannot take a person who is already sick with cancer or some other disease and give them poisons and expect them to get well.
No, of course not.
That's why patients with undergoing chemotherapy and radiation, their hair falls out and they vomit their guts out because it's poison. You see, you cannot get people well that way. And so I changed to a totally vegan diet. But as I said, I realized there were other things that were important. Now, if you want to just talk about food today, we can talk about that. But I just want to tell people that on my videos and DVDs and CDs, there is a 10-step plan. And there are 10 parts of the plan that you need to do to get well. Food is one part. It is a very necessary part, but it's only one part of the 10-step plan. By the way, the plan I use to get well is totally free. except for food, and you have to buy that anyway unless you grow your own, and it's still free, right? The whole plan is totally free. It costs nothing. Everybody can get well from every disease. Now you'll say, oh, well, you had breast cancer, and I have stomach cancer. Doesn't matter. Cancer is cancer. It's all caused by the same three things: malnutrition, dehydration, and stress. Those are the causes of all disease. Now, people are eating plenty of calories, but they're not eating good food, so their bodies are malnourished even while they're becoming obese. So you've got to eat the right kind of food. And then malnutrition, dehydration, and stress. Dehydration, our body loses 10 glasses of water every day just by living. Not even when it's hot, not even when you're working hard. It's much more when you're doing that. It is 10 glasses a day if you're just getting up out of bed and sitting around. All right? If you don't replace those water losses, your body becomes dehydrated. And most of the water that is lost, 66% of it comes from inside the cells. So the cells then can't work properly, you see? And the body is 75% water. The brain is 85% water. All of the nerve, all of the transmission of impulses in your brain, so you can think, are transmitted from one nerve cell to another on waterways. If you don't have enough water, you start getting Alzheimer's. Interestingly enough, Alzheimer's is associated with brain shrinkage. Well, the reason the brain shrinks is because people don't have enough water. And because they're drinking coffee and alcohol and caffeinated soda, all of which are diuretics that take more water out of your body than come in with a drink. You see? So people, so malnutrition, dehydration, and then the third thing is stress. Stress is also very dehydrating, and stress is very damaging to the body. And orthodox doctors in their research are still trying to figure out, does stress cause disease? Well, that's stupid. Of course it causes disease, because when you are stressed, the body has a special mechanism, which every doctor learns and a lot of lay people know. It's a fight-or-flight reaction. That's the answer for, you've heard all sorts of stories about if a child gets caught under a car, mothers have actually had enough strength to lift the car off the child. Well, that is because of the fight-or-flight reaction. Your body pours out huge amounts of adrenaline, which hype you up, and they'll pour out cortisone from your adrenal glands as well, which helps dull pain. But it's supposed to be a short-term thing. Like if you run from a bear or lift the car off your child or something like that. But as soon as that's over, then your body needs to recover and build more adrenaline and let the body rest. But when people are stressed, that mechanism is going on all the time. You see, and it's going on if it's job stress or home stress or whatever stress it is, or stress about the world affairs. And so that mechanism is going on all the time, and it's very damaging to the body when it goes on all the time.
Indeed. And it seems like all of these things that you mention here are things that are, at least in the Western world, rampant. People go on, meat and coffee, and then a lot of stress on that. I mean, it's is this
but, in 1850 in America, the average amount of soda that was being consumed per person was 1.5 8-ounce cans or jars of soda in 1850. By the late 1980s, that had increased. That was per year, not per day, per year. 1.5 cans per year per person. By the late 1980s, it was 500. All right.
God.
Now the average 11 to 17-year-old drinks something like 64 gallons of caffeinated soda a year.
My God.
Now, just to give you an idea, a small cup of coffee, like we used to have 30, 40 years ago, was about 6 ounces, and it had like 30 milligrams of caffeine. It is estimated that in one 12-ounce cup of Starbucks coffee, there's 190 milligrams of caffeine. Now, caffeine is not only dehydrating to the body, it's neurotoxic. It means it destroys, damages nerve cells.
Yeah.
Plus, it causes the reason it hypes you up is it causes the adrenal glands to pour out adrenaline.
Yeah, yeah.
Then you have to pay up that debt. But what people do is they get tired, then they go get another big cup of coffee, and then, of course, it's added. Sugar is added to it, and cream, and all sorts of sweeteners and all that. And sugar leaches the vitamins and